I'm Jessica Thomas. Welcome to the program this evening. I hope everyone is doing well. So I want to thank Viatris for their sponsorship of this program. And I always like to thank MS Views and News as well, because without MS Views and News, we wouldn't have this program. And, we thought of this during COVID, and it's been just a great resource, and it's expanded since COVID, and a lot of people sign up every month to be a part of the community. So we'll move forward. Thank you, Beatrice, for their support. So why does this conversation matter? Why do we need to talk about anxiety and depression with MS? It's because depression and anxiety are very comorbid with multiple sclerosis. 50% of people with MS will probably experience some level of depression at some time. And anxiety can be very common, but it's often underreported. And mental health immediately impacts our disease management. And mental health shouldn't be a side issue. Mental health is our health. It's central to living well with MS. And anxiety and depression and mood changes, they don't just affect our mood, but they affect our energy, our motivation, our ability to stay focused, to stay on top of our care plans. And emotional wellness influences so much of our life and our experiences. And even our treatment adherence, relationships, and even to some degree MS progression. So today is about empowering ourselves with knowledge, compassion, and tools. So this is why the conversation matters, because MS and your moods are really interconnected. And whatever we can do to help you, we want to provide those resources for you. And depression is treatable. Anxiety is treatable. It doesn't mean that you might be free from experiencing them, but they're both things that are treatable. And before we get going, what I'll share too is that when I was first diagnosed, I dealt with a lot of anxiety with my own diagnosis. And I always say I have anxiety like I have brown eyes. It's managed, and it's been managed very, very well for years. But when I first was diagnosed, it wasn't very managed. And so I want to give you some hope if you're feeling that you are having some experiencing symptoms of depression or anxiety, that there's resources there, there's tools, there's people that can be support. And while these may be a part of your journey concurrently with living with MS, it also can be, I don't know, it could be something, to know that it's treatable and it can be managed. So MS and the brain. So MS can impact, areas of our brain that impact mood. I remember many, many years ago, I asked my MS specialist, I said, does MS cause depression, or does having MS cause depression, or does MS cause depression, if that makes sense? The idea of having MS, and it's a little bit like, what came first, the chicken or the egg? They're both really interconnected. Inflammation and lesions can play a role in this. And we know that MS related fatigue often worsens with depression. So MS, is a disease of the central nervous system. And so it's no surprise that the area of the brain that governs, mood and emotion, can be impacted by lesions. But also living with MS is hard. And because it's hard, it can also lead to some challenges. And if you think about the way that the brain kind of helps with communication and helps to communicate things, that it lesions, inflammation, other things can also lead to probably more I can't even say the word, the ability to have more depression. But also emotional regulation can be hard sometimes with MS. And then and I also want to go back to that the idea of having MS can also lead to some senses of some aspects of depression as well, sorry. Again, I a little grace for Jessica today. I'm a little bit tired, the heat and the fatigue, and then and I have a big program I've been planning for and working really hard on at work. So I'm sorry if I mess up a couple words here and there, but I know you guys understand because you're a part of my community as well. So what is depression in MS? Depression is, persistent, sadness, a sense of hopelessness. You may have a loss of, we'll move on to our next slide. You may have a loss of interest in the activities that you enjoyed before. You might not be sleeping well or sleeping too much. Difficulty concentrating. You may be experiencing fatigue. So depression can manifest differently in the general population. It can overlap too with symptoms like fatigue, cognitive fatigue or cognitive fog, and sleep disturbances. So it's important to kind of like watch, any changes that you may have in your mood, because this can key into identifying, is this related to, to depression, or is it my symptoms that are making me to feel sad and causing those things? So, and when mood changes or changes in your mood persist over time, especially when paired with feelings of like hopelessness or withdrawal, that, can increase the ability to have depression as well. So with these mood changes and talking about, I think it's important to know sort of what your triggers are to mood changes, and then also know if you're experiencing symptoms of anxiety and of depression. And we're going to talk about anxiety a little bit more. Maria says, sometimes I have anxiety not knowing why. Is it an MS symptom or just a typical anxiety that everyone goes through? And Vicki says, it's more fatigue than anxiety. I was diagnosed in 2009. So clinical anxiety, so we'll talk about that a little bit. I can actually speak a little bit on anxiety as well, but clinical anxiety would be, excessive worry or fear. It would interrupt possibly things that you have that you normally do. It, can create muscle tension, a sense of restlessness, panic attacks, racing thoughts, heart palpitations. And anxiety can arise from the unpredictability of MS, the uncertainty of about the symptoms. It could arise because of employment, relationships, or even the future. But it's also influenced by biological changes in the brain. So persistent anxiety can create kind of sort of like a feedback loop that can worsen physical symptoms like spasticity, sleep issues, or pain. And so what I'm going to share here real quick is a little personal anecdote, what I've learned from anxiety. It's sort of like the connection of anxiety and symptoms. So for me, I notice when I'm really fatigued, I don't process things as easily. And when I don't process things as easily, then say when I'm driving on the highway or something, and my brain doesn't quite process like all that's happening, then I'm more prone to anxiety when I'm driving, and so I think that, you can kind of see that sometimes that you may have symptoms that increase that actually kind of like brings on more anxiety. So I would say my fatigue is actually the main problem, because if I manage the fatigue, then I don't experience anxiety that can come along with it. But sometimes it's inevitable, like I have brown eyes. So Anne said, what you're saying really echoes what I've been feeling. I've talked to an online psychiatrist regarding a medication, and because she's prescription and her nervous about any of the medications since living alone. It's hard when your brain has access to your own brain. It is hard. And so for some people, we'll talk a little bit, for some people, medications really do help manage some of these symptoms. And sometimes it is a hodgepodge of medication, behavioral activation, cognitive strategies, and self-care that helps manage these. And Anne said, how much of this is perimenopause, which we hear a lot about perimenopause and menopause these days, and we're learning a lot more about aging and MS and hormones in MS. And so I would say talk to your doctor. I'm not a medical professional, but I know that perimenopause is related to a lot of symptoms too. Lisa says, I always have the worst anxiety when I drive. I always have the fear of being the other driver being irresponsible. Joanne says, I have depression. I cannot write, type, knit, crochet, cook, or walk. So what can I do? Okay, so we're going to talk about some coping mechanisms. And Shelley said, a good therapist will provide you with a great toolbox to handle this. And that is very right. So what we want to say is that a lot of these symptoms can be can be normal to experience, but you don't have to live with them in the way that they're unmanaged. You can learn to find ways to help manage the symptoms, and so we'll keep going. So we're going to talk a little bit about mixed emotional symptoms. So this is kind of like the experience of anxiety and depression. And this can be mood swings, lead to irritability. This could also be facilitated because of grief, losses due to MS. And it's common to feel a mix of emotional states. In general, sometimes, but living with MS, you're toggling losses, losses of independence, role certainty, even sometimes just the unpredictability of day to day. So these feelings are pretty complex, and they can show up as grief, they can show up as frustration, sadness, or even fear. And it's okay that you don't have one label for how you're feeling. Emotions are complicated, they're layered, and they're valid. So we'll move on to the next slide. And I'm going to ask you for the chat box. It's sort of one question kind of broken into three, but you can answer the best way you can, because if you're like me, I'm not a good typer, so I wouldn't be able to type long responses. But how have emotional challenges such as sadness, worry, anxiety, fear shown up in your journey with MS? That's actually just one question. So in your journey with MS, how have these emotional challenges shown up? Mine have shown up in the form of anxiety more than anything. And what are your signs that help you realize that something's kind of wrong, that you're not feeling that good? Linda shares, I have an anxiety with mood disorder, and I'm certain when I'm fatigued and my brain isn't clear, it shows that. Yeah, I think that's a good. We have Kimberly from Ohio. She's new here. Thank you for being here, Kimberly. Her shows up with anger, stiffness in the morning. Also, mine shows up as frustration and grumpiness sometimes. I feel like you guys get the best of me, you get the smiley version with energy. But let's see. We have Tijinder that says, I pretend I'm not feeling sadness or anxiety, and unfortunately, I let it out as frustration or anger. So let's talk about that for just a hot second. So that's very common for people. And so in those cases, I don't have it in front of me, so I can't draw it out, but I usually will draw an iceberg, and I'll say, like in the tip of the iceberg, what you see is, I'm sorry, I have a camera that's like doing this like zoom thing. Let me see if I can get it back. Okay, and then I'll get it to stop. Perfect. Thank you for being patient. It's a new camera. You guys don't need to see my nose and I'll try not to talk with my hands, but I have this volcano that I'll draw, or not volcano, iceberg, and the very tip of the iceberg, I'll say, okay, this is where anger is, and that's what people can see because that's how it shows up. But let's look under those layers into the iceberg, and then you can see that it's sadness, it's loss, it's frustration. Emotions are so layered and complicated. Barbara says, sadness and worry, it shows up in my ability to complete my work. Emily says, yeah, the cognitive fog shows up as snippy and generally irritable. Monica says, I have muscle stiffness and feel frustrated. Shelley says, Ollie, it shows up as envy, but I have to realize that my life is not over and it just will be different. Maria says, my anxiety shows up when not active, feeling shut down or sleepy and nervous that something will happen to me. Barbara says, I have to stop and give myself a break, a few minutes to check my thoughts. If it's really bad, I will take a mental health day. I love a mental health day. So as you can see, there, these are, like, it's important to know kind of like what signs you feel, how do emotional challenges show up for you in your MS journey, because it's not going to be uncommon that you have some that happen, because this is a challenging disease sometimes. Is it impossible to live with? No, we can live with it, but we've got to find ways to manage. Ginger says, it hurts because no one truly understands what I'm dealing with, even when I express it. I want to thank you for saying that. I actually spoke with someone today that is not completely newly diagnosed, but doesn't have a good level of family support. And the idea of like, how can I talk to my family about this? Because they only see what they see, and they don't really see everything. So that's a common thing for people. And then Anne says, I have a short fuse these days. It can be irritable and angry. She could easily sleep. And the anxiety gives her nerves, which makes me nervous. Oh, GI nerves about finding bathrooms. It's like being stuck somewhere, like in traffic, which is a hard thing. And then Sherry says, I feel some relief about hearing other people get angry. This that is new for me, but all this stuff with moving, I've dealt with some anger. Yeah, anger a lot of times is like the costume of another feeling, but definitely that's not an uncommon thing to feel. So we're going to move on to our next slide. Thank you so much for your participation, by the way. So when to seek help? So it's important to seek help when you're one. I think it's always good to go to counseling, to have a third party, someone non-biased, to listen in, to help you develop a coping toolbox and develop resources. Like it's always a good time to work on improving yourself and to work on strategies. Like there's nothing wrong with that. So I'm going to put that out there. But another time to seek help is when you're noticing that your symptoms are interfering with your quality of life, impacting sleep, your appetite, your relationships, your ability to work. If you're having a loss of interest, and absolutely if you're having any suicidal thoughts or ideation. When symptoms don't go away or begin to interfere really with your daily life, it's time to reach out. And if you ever have suicidal thoughts, this is important just to mention. It's important to seek a medical, treat it as it's a medical emergency, and call your doctor, go to your emergency room. Early intervention is important. Now, who can help us? When I was newly diagnosed, we'll move on to the next slide. When I was newly diagnosed and I was experiencing a lot of anxiety, I had to look into who could help me, because my anxiety was really leading to not functional things for myself. I was losing my ability to drive in a way that I was comfortable, and I was starting to lose like some of my comfort level in social settings, etc. So for me, I remember talking with my doctor about it. But you can talk with your doctor, talk to your MS specialist. Now, they're not going to be able to provide a counseling session for you. But you're between your doctors and your primary care provider, they may talk with you about a referral for counseling. They may talk about a medication for you, which may be very helpful. And they will know who in the community is probably a good therapist to see. You do not have to see a therapist that is specialized in MS. It's very rare to see that, but you could see somebody who specializes in chronic illness, or someone who's experienced a lot of or has had a lot of work in loss and grief, because that's a big part of it. I'm going to stop and read for a second. Linda says, anger helps me push forward. Maria says, yes, anger kicks in. Vera says, I get anxious and frustrated when I can't move my body, specifically my legs. I take a couple of deep breaths, calm myself down, and try again. Kenneth says, I mourn what could have been. I think it's important that we give space to the things that are losses. Linda says, I have a telehealth therapy session once a week, and it really does help. We've had a lot of people in the MS Mental Wellness chat since the beginning. A good number of people go on to get therapy, and that's so cool, and it's such a helpful thing. I highly encourage it. Kenneth says, when the thoughts start to snowball or spiral down, seek help. And Barbara says, my depression was really affecting me, and I reached out seeking therapists through my job. My therapist has been helping me to learn how to check my thoughts and find ways to reset my thinking at different times. The therapists are really great at that. And Tina says, my emotions can be all over, more anxiety probably lately because my husband was diagnosed with bladder cancer and starts chemo tomorrow. That's a lot. And I've been more withdrawn probably lately. When you're facing a health challenge, either for yourself or someone that you love, that can naturally create some anxiety. So I hope that we can provide maybe some resources of that can be helpful as well. And Sherry says, my therapist has MS, so she gets it. I'm lucky I found her. We meet on Zoom weekly. That's really cool. Okay, so let's move on to our next slide. So there's, talk therapy options, to help with anxiety and depression. There's different types. There is, cognitive behavioral therapy. There's acceptance and commitment therapy. There's group and peer therapy. There's, the therapy that CBT can help you to reframe unhelpful thoughts. Acceptance and commitment therapy focuses on accepting uncertainty and kind of aligning with your values. And then group therapy can help you have like a shared experience, which is important. That's kind of part of the magic about this MS Mental Wellness chat, is that people get to get a sense of connection, that they're not alone. We'll move on to the next slide. And there's also medication options that can help. There's antidepressants such as SSRIs and SNRIs. There's anti-anxiety medications, and there's also medications that can help to assist with sleep or fatigue. Medications are not always the answer. Sometimes I think it's sometimes it is the answer too. I think they're really good in conjunction with behavioral activation, things that you can do, and strategies that you can put into place to help, or counseling. I've seen the most success for people when they're doing multiple things. And even in my own journey early on in my own diagnosis, when I had anxiety that was really bad, it paired really well with cognitive behavioral therapy. So I had a medication from my primary doctor, and then working with cognitive behavioral therapy to work on some strategies. And so it sometimes can take a lot of different things. So Anne says, I moved to Maine to get space. Unfortunately, I need to start a new support system, but it can be done. And problems with coverage made it worse to get teletherapy. And so, yeah, that can be, thank you for not giving up. And she didn't give up. She's still looking and identifying. And that's the hard thing, is sometimes there can be a barrier to finding like a really good therapist or someone that's a good fit for you. But keep at it, because you deserve those resources. So we'll move on to the next slide. We're going to talk about integrative and lifestyle supports. So this is where you think about like nutrition, sleep, exercise, mindfulness, meditation, art, music, pet therapy. So think of mental health like a puzzle almost. And therapy and medications might be key pieces, but so are daily things like movement, sleep hygiene, being creative, and connecting with animals or nature. Even small lifestyle changes in these areas can support our nervous system and improve our mood. So let's think small for a minute, because So when you think about movement that you're able to do, because easily we can, sometimes we can deviate to what we can't do. But let's think about the movement that we can do. Is it, chair yoga, stretches, going outside. So the MS Views and News now has a community chat. It's goodness, I'll try to describe it. It's like an app that you can have, or you can have it on your computer. And it's been really cool to kind of see people talking amongst each other. But one of the things I thought was really cool is seeing someone who talked about kind of walking and what they're doing right now to move, because if you have trouble with heat, and that you can be very limited in the weather that is very humid and hot for some people. And so you just shared a picture, very inspirational, how how she's moving. She's found this like little shady area and kind of modified. Whereas my husband and I have been committed to doing moving every day this summer, but sometimes I go to Walmart and we were walking in the air conditioning, not very fast. Not saying that's the best thing or the solution, but just kind of finding the small little things. But think about the small things that you can do, and how, like, the little things that improve your mood, and what gives you a sense of relaxation, or helps you to feel a little bit better. I'm trying to see if I can find anything over here. Okay, this is from last year, but I just grabbed it because I usually have like this is the dog of my dog Charlie, is now much bigger. But I do a lot of like crafts and like little painting things when I feel like I need a little break, or I go sit out on the porch if it's not too hot. So finding those little things that you can do. Oh, Kevin, yeah, thank you for saying it. So the chat that MS Views and News has is called School, SKOOL. But I really have liked kind of peeking at it and seeing what people are doing to contribute and what they're sharing. Emily says, I found volunteering has helped me so much with depression. Feeling helpful and needed has been an amazing avenue. That is amazing and awesome, Emily. And then Maria says, my Chuini, super cute, calms me. And then she says, does she need to be trained to be a therapy dog? I think animals are so helpful. And then Monica says, do you think a service animal is helpful to treat with anxiety, depression? I think a service animal absolutely can help with anxiety and depression. But I honestly think just a really good animal, a really good pet, it can be helpful to anxiety or depression. And if you have just a pet that's not a service animal, let me know if they're helpful. I know that my dog Charlie, the one I had the picture of, he's not in here with me right now because I just felt like he was too wiggly, so it'd be hard to concentrate. But he's really big. He's very in tune to me. Like if I'm feeling tired, he'll rest with me. If I am feeling kind of sad or something, he'll notice. I was watching a movie one time and I was crying, and he came over and he sat with me. Animals are very intuitive. Linda says, my dog is my comfort dog, very connected to me. And Kimberly says, my dogs are everything. They keep me from being lonely. And Katrina says, my pet lifts my spirits. So they don't necessarily have to be service animals. I think a comfort animal is a good way to look at it too, because service animals can be very expensive too, but they're providing so much service through the connection. So let's move on to the next slide. And I want to ask you, so what has helped you to feel supported emotionally? Have you ever tried therapy, medication, or other supports? What worked for you, or what didn't work for you? And then as you guys are writing, I'm going to continue. So Barbara says, I'm a grandma to my daughter's dog. He follows me all over the house. He is sweet. That's cute. So Dion asked me to repeat the name of the app. And so S as in Sam, K as in kangaroo, O as in ostrich, O as in ostrich, and L as in Lisa. School is the name of that. So there's a lot of things that that can help you to feel emotionally supported, but it's important to think about what things do make me feel emotionally supported. Vera says, I do online art sessions once a week with another MS organization. That's really cool. And it's helped me so much through conversations with other people with MS and creating art. Paul says, was able to go skiing outdoors for this, and he shared. I will look at later, but I can't see it right now, and shared a video. Vicky says, my friends, family, and sorority sisters help me to feel supported. I've tried therapy and it helped a lot. Traveling has helped tremendously as well. Feeling for my sorry for myself doesn't work. That's very true. Kimberly says, therapy and medication for over 20 years. It gets me by, but I'm rarely joyous. I think when we think of happiness, I feel like happiness and even joy sometimes are things that to think about it as a direction, not a destination. Because I feel like if I was to ask people, how many of you feel happy? I mean, I wouldn't even feel happy, but but can you access small things that give you a sense of joy? I think that that's kind of where there's some magic. And I've done a lot of research on happiness and finding happiness. Kevin says there must be a link to the MS school group on the MS website, MS Views and News website, and there is, absolutely. Maria says this session makes me feel supported. Thank you so much. Linda says talking to others and sharing experiences supports me emotionally. Barbara says therapy, positive motivational thoughts, thoughts on Instagram, webinars that provide inspiration, group meetings. David says my support group in the Bahamas. Kenneth says CBT, not so much as therapy, but more as a wellness check. Mary Beth says, Lexapro, PT, yoga, eating healthy, prayer, and venting to my therapist. All keep me sane. Do you see how that's like a hodgepodge of a lot of different things? And Kimberly says, true. And it's the sense of direction, not destination, for joy and happiness. Katrina says, feeling heard by others and healthcare providers, still finding purpose. It's different for everyone. Sherry says, the unconditional love I get from my dog helps me so much. She doesn't judge if I'm sad, having a bad walking day, or anxious. That is so true. The dogs really, our animals really don't judge. My cats do sometimes. I'm kidding. I do have 3 cats and they're kind of silly. David says, this group. Thank you. Anne says, honestly, when I'm able to go out solo, because I feel like I have more control over how much a new friend knows about me. Friends tend to ask how I'm feeling from an assumptive place, whereas meeting a new friend is a nice opportunity to ask me from an outward place. It's less about MS then. Yeah, it's nice when our relationships are not all encompassed about MS. Paula says, I initially saw a psychologist, but when I didn't have to stay with that, I worked hard to regain the use of my right side, and then she volunteered some, and now she's involved with Labrador training, and running AKC field trials. That's really cool. So she is a dog expert. Sherry says, I also watch funny animal videos. Funny animal videos or things with babies, what that does, we have happiness chemicals, and happiness chemicals make us feel good. And so there's a happiness chemical called oxytocin. It's one of my favorite ones. And how we activate that when we give a hug to somebody, or when we get a hug, or touch, you activate it, but also being around an animal, watching a funny animal video, or a funny baby video, holding a baby, those all activate that happiness chemical called oxytocin. So for people that don't, that really struggle to feel good sometimes, it's good to know about those, the activation of those happiness chemicals, because you can do small things to activate them, and they help you feel a little bit better. Like, for example, you can get a little surge of dopamine when you complete a task. You also can get a surge of dopamine by eating chocolate, but we're going to talk about it from a task perspective. And so if when things get really busy and chaotic, which they do for often for a lot of people, or you feel like there's a lot going on, I like the idea of not having a to-do list. I like the idea of having an I did list. And the reason why is that when you check off a box of something that you've done, like if it's on a to-do list, you feel good. You feel get a little bit of dopamine from that. When you do it on an I did list, it's like a constant, like, oh, I did that. I got up, I took a shower, or I changed my clothes, or I made the bed, or, and it can be the smallest things. I went to the mailbox. I ordered my groceries online. Like all the little things that you've done, if you can give yourself credit for them, then you start to feel a little surge of dopamine. And then serotonin, we can get that from, a little bit of sunshine, which is incredibly helpful. Anne said that her animals do judge her. It's funny. Emily said routine is helpful for me. Bedtime despite my free spirit desires. Also learning how to say no. You can love family from afar, either mentally and or physically. And that is true. You can love your family and people that are complicated from a distance. You don't have to bring them in, having good boundaries. Focusing on others helps you to take off your mind from yourself, and that's true. Kevin says, he's not satisfied with his medication. I think it's always important to do check-in with your doctor about medicine and how it's working, how you're feeling, etc. Vicky says, I only put 3 things on my priority list every day. Emily says, I have to disassociate with those who are not supportive. It's important to keep healthy people in your life and be careful about the unhealthy people in relationships. And it's difficult when you have to set boundaries with others. And so let's move on to our next slide. And so what I'm going to tell you is we're not going to go through the whole presentation tonight. But what we are going to do is we will end with some strategies, because this has been a really full group tonight, which is awesome. It's important to name our emotions. It's a very smart thing to do, and it's actually a very helpful thing to do. So practicing doing journal check-ins or emotional check-ins, especially, for a couple of people that could identify with anger. You don't want to wait till you get to anger. But if you're angry, you can say, okay, I'm angry, but let me think about this. What are some other things that I'm feeling right now? Journaling or naming your mood. And there's this concept, it's a good thing, tame it to name it. Or name it to tame it, sorry, name it to tame it. And so when you name your emotion, like, for example, I'm feeling overwhelmed, then, or I'm anxious about my MRI coming up, you create space between you and the emotion. So you're not just wearing the emotion. And that gives you a little bit of clarity and gives you some space for action to do that. So having an emotional check-in with yourself can build some self-awareness. The next that we're going to talk about is building a routine. Anchor your day. We'll move on to the next slide with simple habits. Schedule low energy tasks. I do that often. Protect rest and recovery time. Be very thoughtful about your rest and recovery. And when you're thinking, and if you have a period of time that you have a lot going on, making sure that you're intentional about scheduling some time and setting boundaries. For example, I'm working on a pretty big education program for my full-time job, and I was working meetings all the way through, but I gave myself a hard stop so I could stop and rest for tonight's program. And it was a non-negotiable stop for me. Finding those things that you have to do. when you have a flexible routine, it brings rhythm and predictability. When you have a routine also, it can help you with apathy, because sometimes we can have like a flatness or just kind of feeling apathetic is what we would say, is kind of like, I don't really feel like doing anything. I don't want to. And for people that are dealing with apathy, routine can be really helpful, because routine kind of, gets you to kind of go through the motions to keep you on track. And the reason why we want to do this is there's this concept. I'm scared to do it with this in my camera right now. I'm gonna have to figure out my hand things with this camera. But there's this concept of spiraling down. And when we spiral down, like say we wake up and we decide to not take a shower. I'm just gonna maybe give you an example for a work day for myself. So if I woke up and I decided not to take a shower, and I just threw clothes on for the day to get ready. And then I would notice that my energy wouldn't be as good. And it's like these like little spiral down pieces. Whereas if I have a little routine, like I wake up, I get up, I brush my teeth, I wash my face, I decide if I'm going to shower or not, but I do other self-care things. And then the other things can kind of lift you up. While you might spiral down, you can spiral back up in the same way. But it's important to have that. So the next resource we're going to go to is the idea connection. And I'm going to applaud every one of you for being on here because connection is so important. It's so, so, so important. And you don't need, connection doesn't mean like you have a dozen of friends. You may have a dozen of friends. I don't, but you may have a dozen of friends, and that's okay if you do. But really, it's I think it's more about having solid connections, and also some soft connections, but connections like this even too. Feeling heard, feeling understood, having safe places. I think one of the things about peer support is that it reduces shame, and it reminds us that we're not alone. And that's why groups like this have been very helpful for people, is that it's a safe place. As a facilitator, I feel safe saying I might mess up a word tonight, earlier, because I know that you're not going to judge me, that you guys understand what that can be like sometimes. I'm going to stop and read for a second. Kenneth says, putting a wheel on the refrigerator and then have a magnet for where you are and another for where you want to be. Help let others in the house understand what's going on. I think communication with your family and people that care about you is so important. And Linda says, I so relate to the spiral up and down. For me, it's like shifting up and shifting down, like a 10-speed bike. Yeah, like absolutely. So where do we go from here? I think it's important to create a wellness toolkit. We're going to continue, and we always will continue with the mental wellness chat, talking about anxiety and depression and these tools and resources. And all my regulars know that these are all embedded in what we're doing. So even though we didn't get through the whole PowerPoint today, we're always talking about these things. But I want you to think about what you could do to create a wellness toolkit for yourself. Thinking of some calming strategies, having affirmations, music, or breathing tools. Thinking about some resources that you may be able to access. Being aware of if you're having symptoms of anxiety or depression, where can you go? Who can you talk to about it? And having support contacts ready. I want you to know that you're not alone. On the average, 50%, 1 in 2 people living with MS may experience depression, and anxiety is often a shared experience. I share my own anxiety and my experiences with it because I know that I'm not alone, but I know that it helps probably you if you're experiencing it. And when we connect, it reduces isolation. So let this know that let this just be known that you're not broken, you're not weak. Emotional struggles are common, and a part of the MS Mental Wellness Chat is that we work through them and we find resources. And even in isolation, connection is possible. So with peers, professionals, people that care. We're going to thank Viatris. Okay, so this is the ending slide that I've been using for like 4 years. And the reason why is that I'm not saying goodbye. This is a group that we have a commitment to help people have this connection and have this mental wellness resource for everybody. So I'm not saying goodbye. I'm going to say, I'm going to see you later. Be well, and I'll see you in August.